a new NIH study that has everybody talking, scientists followed 14 of the 16 contestants from season 8 of The Biggest Loser, monitoring them for 6 years after the show. They found that all but one had gained some of the weight back. 4 of them even reported being heavier now than at the beginning of the show.
When you attempt to change your body weight, your biology will fight back.
Dr. Kevin Hall is the lead scientist behind the study. He says that while the contestants all had a normal metabolism for their size at the start of filming, years after, their metabolism began to slow down, a mechanism he says the body uses to return to its original weight.
Those who know what goes into creating a reality TV show will be the first to tell you, if they wanted to take a shot at losing their jobs, there's almost no reality here. And they are produced to attract the lowest level of human intellect. The person who has trouble figuring out a remote control, the person who asked what the last book they read would answer something to the effect of, does the Victoria's Secret catalog count? Because producers know these are the easily amused and easily duped. Reality weight loss shows are filled with more than The Biggest Losers on screen. But those who want to believe the massive amount of weight loss will indeed turn around the lives of every contestant, leaving them happier, healthier, and thinner for the rest of their lives. That has about as much truth as those quacks who tell you drinking diet soda will help you lose weight. And a new study focusing on the contestants from the NBC weight loss program reveals what the producers will never tell you: the medical reasons why such diets and quick fixes will almost never work. Let us then break figurative bread with the deputy health editor here at Newsmax, also co-author of the Da Vinci Baby Boomer Guide, if you will. Let's talk to those boomers and those afterwards with Nick Tate. I am not shocked, my friend, whatsoever by this, because anybody with common sense will simply know that you can drop the weight like that. But it was shocking that almost everybody gained the exact amount of weight back and more.
That's right. I mean, anybody who's tried to lose weight, made a New Year's resolution, and lost a couple pounds in January only to gain it back in February knows it's a lot easier to lose the weight than maintain that weight loss. But what is surprising is why. In the cases of these individuals, it wasn't just that they went back to old unhealthy habits of eating too much and exercising too little. The dramatic weight loss fundamentally changed their metabolism, their resting metabolism. That is what governs how many calories you burn at rest, and it changed the hormones in their bodies. Leptin specifically, which is the appetite hormone that regulates food cravings and hunger. So today, not only do they weigh more than before this program started, but they're constantly hungry because their hormone systems have been thrown out of whack.
The body has a memory. It's quite frankly put. When I was playing athletics much younger in life, working out of the gym, they tell you the muscles have a memory, the body does as well. You can't trick Mother Nature.
That's right. And in fact, what they're trying to do with these weight loss diets is trying to make that change. But in fact, it's having a counterproductive effect. For these poor folks, it's going to be harder for them to maintain healthy weight going forward. The good news is that we're learning something about it, and there are a couple take-home messages here. Extreme diets and weight loss don't work. You don't have to exercise every day, but only on those days that you eat. And what I mean by that is...
Any day ending in Y.
I'm joking, right. But calories in, calories out. If you eat more calories in your diet, consume more than you're burning, you're going to gain weight. If you eat about the same amount of calories as you burn through activity and exercise, you're going to maintain the weight. And of course, if you eat fewer calories than you burn up through exercise, you're going to lose weight. So those are the principal things. There are some things you can do to boost your metabolism through exercise, certain foods, peppers, protein, tea and coffee, and that's where we really should be focusing.
Eat smart, exercise, get some physical activity.
That's right.
We're always back to the same things.
We are, you're right.
90 seconds left. Here's something interesting, and this shocked me. Researchers at Johns Hopkins finding that medical errors could be the 3rd leading cause of death in the United States. That's shocking. These are the people that are basically educated to care for us, and they're killing us.
1 in 10 deaths in this country are tied now to medical errors. That's 250,000 deaths a year behind cancer and heart disease. What's happening is that we're just discovering this now because death records, death certificates don't typically include any information on what might have contributed to a person's death. So if you have cancer, heart disease, diabetes, you go in for surgery, have pneumonia, that's what's recorded on the death certificate. But there's no place on the death certificate to say that getting the wrong drug, that your doctor giving you too much of something, or a drug that interacted negatively with a drug you're already taking was a contributing factor to your death. So what this study from Johns Hopkins should do is make you aware that there are some things you can and should do as a patient. Some of them are right here on the screen. You need to tell your doctor about every medicine you're taking. You need to make sure that you understand your doctor's instructions, because we know they're notoriously bad in their handwriting. Ask for test results in your own research. Coordinate your care with your doctor, and the point really is be an advocate. Speak up, ask questions. Don't just take what your doctor says at face value.
I only got 15 seconds left, but can I add this too? Talk to your doctor and say, speak plain English
That's
to me
right.
and tell me the truth as well. Don't gobbledygook this because I can handle it. I'm an adult.
That's a good idea, and if you don't understand, keep asking questions until you do understand.
Which sometimes the doctors don't want to answer,
Maybe.
but you've got to stay after them because it is still your health at the
That's
end
right.
of the day.
You are the advocate. You're the one who loses.
Always a
if you
pleasure,
don't.
my friend. Thanks so much for joining us. Here's something else to keep you healthy, if you will. At least keep you healthy when it comes to talking about what you want to talk about. Something new we're doing right here on The Hard Line. You can do it right now. We're going to show it all next week. It is the 15 Seconds of Fame. You rant, rave, react. Go to NewsmaxUSA.com. You get to leave a 15-second video message. You choose whatever you want to talk about, and then we get to go ahead, edit it down, and show it right here on the show. Stay with us. The Hard Line continues right after this.